Video games are designed to be addicting, so you have levels to the game where you must finish one level to make it on to the next level, and each level has something that's more enticing than the next. Whenever you have to leave that level without finishing the progress, kids start to ruminate over, well, I didn't get to finish my game. I don't know how long it's going to take to get that progress back because there's no time frame. There's that whole addicting piece to it.
Hello everyone, this is Ekaterina with Trust Me Mom, and my guest today is Alex Dimoff. Alex is a licensed professional counselor, and one of her specialties is treating OCD in children and screen addictions. And today, obviously, would like to dive into talking about how to spot OCD, what is OCD, and what to do about these addictive behaviors when kids cannot get off their screens. Alex, welcome to the show.
Thank you so much for having me. I'm excited to be here.
Alex, can you tell us more about your journey? Why you decided to become a therapist?
So from a young age, I always knew that I wanted to be in the helping professions. And what got me interested in therapy in the beginning was abnormal psychology. So mental health disorders like anxiety, depression, and OCD, and what makes people tick and behave the way that they do. And in my friend group, I was always a sounding board and a good listening ear, and I had somebody tell me that I would make a great therapist, so I liked the idea and I stuck with it, and that was the track that I pursued in college, and here I am today.
Wonderful. So then let's talk about OCD. Can you define what OCD is?
Yes, so OCD stands for obsessive compulsive disorder, and there's two components of that. So you have the obsessions, which are repetitive thoughts that cannot get out of your head, and then they're followed by the compulsions, which are behaviors. So what a lot of people know OCD to be is the excessive hand washing, shutting the lights on and off, and usually there's the obsession that is driving the compulsion. So, for example, I think that I stink, or I think that I have germs and I'm going to get sick. So I need to wash my hands for an hour. I need to wash my hands for this many times in order to get rid of the germs or to not get sick. And these compulsions are time consuming. So they're lasting for more than 1 hour per day. And for it to be at the clinical level to be diagnosed as obsessive compulsive disorder, these behaviors would need to be occurring for at least 2 weeks, and they would need to be distressful to the client's daily life.
Okay. And then, so how do these behaviors develop? Is a person predisposed to it, or something may trigger and they suddenly become obsessive about certain things?
It can be either or. I've seen clients where there is a family history of mental health disorders. There could be a family history of obsessive compulsive disorder or an anxiety disorder, so they have that predisposition biologically, or it could be something that happens in their environment. And I know something that we were going to dive into today was the topic of electronics and video games. And I see that those can often drive obsessive compulsive behaviors.
Okay. Well, I don't want to jump too ahead. Obviously, I really want to
Okay.
talk about it because it's such a painful subject for many parents. But will all screen addictions be considered OCDs, or there's like a normal spectrum and there's a really out there obsessive spectrum?
So there's what would be considered age appropriate for screen time use, and then you see what goes into the far end of the spectrum of this is obsessive compulsive disorder or it's a screen addiction.
Okay. And then when you mentioned that obsessions should be making, what was the term, making life difficult for the person who has these behaviors, so basically some kind of a struggle, something unpleasant. What if a person doesn't mind washing hands for 2 hours every day?
So it would have to be causing distress, dysfunction, and deviation to the client's everyday life. So how do they have time to be washing their hands for 2 hours per day? At some point, that is going to cause distress and dysfunction to their daily life. It's interrupting other tasks. And at the clinical level, it would have to last more than 1 hour per day. So if they're at the 2 hour mark now, that is at the clinical level.
What could be done about it? I assume therapy, but is there another way of treating OCD?
So there's different routes to treating OCD. There's the therapy route. There's also the medication route. I'm not prescribed. am not trained to prescribe medication, so I can't speak much to that, but I can speak to the therapy side of things. And the modalities that I use for treating OCD are cognitive behavioral therapy and behavioral therapy, where with the cognitive behavioral approach, you're diving into the beliefs that drive the compulsions. And then there's the behavioral side of things. So you're using behavioral interventions to decrease the compulsions.
Hmm. Can you give us an example of one of your cases, just to illustrate what OCD could be besides washing hands?
Yes. So I have a client that I used to work with. They were a young adult and they had additional diagnoses. Just to give a background on this client, of autism and intellectual disabilities. When this client was not receiving attention from mom, the client would pull out chunks of hair and would pick at their skin to the point that their skin was bleeding. And the only way that the behavior would stop was if mom would pay attention to it. So it's at the clinical level where it's causing distress, dysfunction, and deviation. And there's that belief of, if mom is not paying attention to me, then I have to do something to get mom's attention. So with the autism and intellectual disabilities, there's challenges to utilizing cognitive behavioral therapy. So I used more behavioral interventions with this client. One of the things that we did was a reward system based on the client's behaviors that week. If the client could go all week without picking at her skin and pulling out her hair, then she would earn so much money at the end of the week to shop, and her behaviors during the week would determine how much money she would get to spend. So once a week, we would take the client out to the store to shop, and she understood that if I have this much money, that I can buy what it is that I want. So she liked to go to the Lego store, for example. So if she had enough money from that week, she could buy the Lego set that she wanted. And if she didn't have enough money, then she knew, I can't buy this today. I'm going to have to wait until next week. And that was an intervention that was successful because she did understand the concept of money and being able to leave the store with something or leave the store empty handed. So if this client was pulling out her hair every day and picking at her skin, then she wouldn't earn any money to the store, and it would just end up being a looking trip and not a buying trip. Oh, that was a successful intervention with this client because it's helpful for them to have a chart in front of them to see their progress and how they're doing. So whether that's a sticker or just a check mark or writing yes or no if the client got money, whatever works for them. And then they can see how they're progressing throughout the week. So their money would be tracked that way based on their behaviors.
And it sounds like there should be a lot of cooperation from parents.
Parent participation is important because as the therapist, you're only spending so many hours with your client per week. So if they're coming to see you in the office, that's 1 hour per week. If the therapist is coming to your home, that might be 3 to 4 hours per week. So what happens in between sessions and parents carrying out the interventions are vital to their child's success.
Hmm. How do you coach parents? Because it's so hard for them to change their own habits. So, for example, if they were in a certain circular pattern where parent does one thing, child responds, it becomes dysfunctional, but it's very hard for parents to suddenly switch in many cases. So how do you guide parents and coach them as well to change their own behavior?
That's a great question. So, usually I like to take small steps with parents because I know what they're capable of. And I know when you give them all of the interventions at once, it can feel very overwhelming to them. And parents need to feel empowered, and that whenever they can carry out something that's small and they feel successful with that, then they can continue on to do more of it. So this is jumping over into electronics and screen time about coaching parents, but something that I have supported parents with was getting into the accounts that controlled all of their child's electronic devices and changing the password. That way, only parents had access to the accounts, and their child couldn't go in to change the settings because they knew their parents' password. Something else that I had parents do was, if it was necessary, was lock up electronics at the end of the night, because even when the screen's shut down, if you're going into the account and utilizing all of the settings of 2 hours screen time limit, shut the device off after that 2 hours is up. Somehow kids find a way to go in there and change the password and increase their screen time. So if that is happening, parents take the devices, lock it up so it's out of their child's hands, and now it puts the power back into the parents' hands with that parent-child relationship where the child is no longer in the parent role and has the power.
Okay. And why does this addiction happen? Why people, especially now we're talking about kids, so it sounds like a child is drawn to electronics, or a child feels they have to scratch themselves, pull the hair. So there is a need deep down. And in one case, you said that the daughter wanted attention, but is that need overall basing anxiety or feeling I'm not enough, I'm not loved enough? So, what is that underlying core need that they're trying to feel?
It depends on who the child is because they each have their own unique needs and why they need the attention or why they need to be on the screen. So, if I dive into the screen side of things, video games are designed to be addicting. So, you have levels to the game where you must finish one level to make it on to the next level, and each level has something that's more enticing than the next. And then you have points or tokens that you earn through each level of the game or for how long you've been playing the game. It really just depends on the game. And then there's different skins to the game that you can have. And then the more skins you have, then the more fun the game becomes. And with some games, you cannot save progress. So the only way progress will be saved is if you stay with the game until the level is over. So there's no set time for how long that level will take. So there's something addicting about it that keeps you coming back and wondering how long is it going to take. And whenever you have to leave that level without finishing the progress, now kids start to ruminate over, well, I didn't get to finish my game. I lost all of my progress. I don't know if I'm going to get that progress back. And I don't know how long it's going to take to get that progress back because, again, there's no time frame, which there's that whole addicting piece to it.
Yes. And it almost feels like it's their own little treasure. So, on one hand, they're guided by curiosity, as they're unlocking new skins and new levels. But also, looking back at my childhood, I remember collecting stickers, collecting toys, and it felt like it's an equivalent of being millionaire, billionaire as an adult, where I have all the money and toys, cars, and houses. So to a small child, having a collection of gum, collection of stickers, collection of toys, and maybe even advancing in the game if their peers also playing the same game. I'm thinking about Minecraft as an example where you could advance, you have all these mods and other things. It feels like they're ahead of their peers. Would it be a similar analogy compared to adult toys and money?
Yes, just like you said with that competition with peers when I mentioned the skins and kids are playing with their friends. Now it's, well, who has the most skins? And then you'll see throughout different seasons of the year, there's exclusive skins to that season. So let's say around Halloween, there's skins that are exclusive to Halloween. So if they don't earn those Halloween skins, then they can't earn it again. And it's that bragging rights of, oh, well, look at what I got to earn and you didn't get it. And who has the most skins? It becomes a competition.
Yes, almost driven by sense of self-importance and self-significance in relation to other peers. What can parents do to make the gaming addiction more manageable?
So, some interventions that I've coached parents through are setting timers and priming. So, this is where the hands on approach between therapy sessions is important. So, priming is when you're telling your child what to expect from start to finish. So, if they have some free time between activities, maybe it's that time they get home from school until they have to leave for an after school activity and they have time that they want to play video games or be on their iPad. Parents would prime them. You're at home right now. You have some free time to yourself until it's time that we leave for this activity. You can play with video games. You can play on your iPad. Whenever it's time for us to go, the iPad has to be put away or the video games need to be turned off, and then you're going to leave. I understand that you have progress in the game that you may not be able to save, but even if you're in the middle of the game, we do have to put it down. You know what you need to do to make that progress so you would be able to get it back again. So now it's setting that expectation for them of, okay, I have some time to play my game, and at some point I have to leave, and I may not be able to save my progress. And also the utilization of timers. Clients find this helpful, whether it's on a phone or they have ones with the clock that it shows the time counting down, and then they can just look on that clock and see how much time is left. So you might set a timer of you have 30 minutes on your devices, and then they can see the 30 minutes is ticking down, and then maybe it's about 5 minutes until we leave. So again, you give them that 5 minute transition warning, because I've seen children struggle when it's abrupt transitions and it's just, okay, it's time to go, clean everything up, get your shoes on, we're headed out the door and getting in the car. So whenever they know what to expect and have warnings, it's a smoother process.
What to do if you gave all the warnings and the child gets really aggressive?
At that point, you would have to remove the device from them. And depending on the child's age, so I would say up to 10, 12 years old, it's appropriate to put them into a timeout. So, okay, I can see that you've become aggressive. You aren't keeping your hands and your feet to yourself. Put them in that timeout. And with timeouts, I go by the child's age. So if they're 10, that's a 10-minute timeout. 5 years old, 5-minute timeout. And that's just their time to calm down and regain themselves until it's time to transition on to the next thing. And if they are becoming aggressive when they're using their devices, that's when you utilize consequences and you take the device away, and then they have to earn it back. And with some clients who do become aggressive, whether it's with devices, video games, or just board games, any kind of game in general, priming would also be setting the rules around games. So before we even get started, what are the game rules? So hands to self, feet to self, no screaming. We use nice words. If you break any of those rules, then the game is immediately over.
What if they break things around the house? Let's say, start crashing furniture, breaking dishes, because some of the audience, some of the people who are listening may deal with that with really aggressive kids.
Yes, I've seen that before with my clients too, who can become very aggressive. So at that point, that's where it's helpful to have the time out where they have to calm down, and having a space in your home that is safe for a timeout. So if there's a small part of your house or a room where there is nothing that is breakable or that they could harm themselves with, then you put them in that room until they're ready to calm down. And
Hmm.
sometimes it's just in the moment, then you're scanning the environment and seeing what is something that they could break or what is something that they could use to hurt themselves or somebody else, and just very calmly go over and you start to remove it to make the environment safer, because this is something maybe parents aren't always thinking about.
Right. And how many kids outgrow their screen addictions? Basically, again, reflecting back, when I grew up, games were already available. And I remember being really drawn to games, but now I don't play any computer games. Well, some other people are still, it's a big part of their life. So, do you have any statistics or provide any guidance on what happens in general, who stays addicted and who moves on and does other things?
I think who stays addicted versus who is able to move on and do other things or just spend less time on video games is who their support system is. So, do they have parents and outside supports like a therapist who are encouraging them to meet their goals? So, I have one client in mind that I've been working with for a long time and would use video games and virtual reality for their primary source of social interaction. So there is no face to face interactions happening. And just over the years, with support and continuing to work on the same goal of having those face to face interactions and finding what is rewarding about them, when the client enjoys what they get out of the face to face interaction, they start to spend less time on the screen. So I really think it just depends on what kind of support they're getting and who is holding them accountable. Because if nobody is holding them accountable and they enjoy what they're getting out of video games, then they see no reason to get off of it.
Yes, that makes sense. Let's talk about therapy. What should people expect from therapy? And then when is a good time to ask for help? Because there's still, I think, not so much stigma these days with seeing therapy, but there seems still some people who go, I'll figure it out, it's gonna be fine. And it would be better if they actually reached out for help.
Yes, because it's a lot for parents to be in every role whenever parents are trying to work and provide for their families, and then they're raising their children and disciplining them, and then they're trying to be teacher when they're helping kids with homework, and now you have parents who are trying to be therapists. It leads to burnout. So if they have a therapist that can help them treat their child and provide recommendations for interventions, and just to have some support along the way is very helpful. And whenever they might want to start consider looking for therapy is whenever they're feeling like this is too much to handle on their own, that they're spending a little more time than they would like in that therapist role. And when I go back to talking about the clinical level, so you have what is causing distress, dysfunction, and deviation from everyday life. So if these behaviors meet those 3Ds and it's been going on for 2 weeks or more, and you see that the compulsions are lasting for longer than an hour, then that would be time to seek support and see, is this at the clinical level?
And then, as far as the duration of treatment, some people may think, oh, I'm gonna see a therapist just once and everything is fixed. Others will be like, oh no, it's a 20-year commitment. So, Can you give me the pointers? What is reasonable to expect?
So it really depends on the client, but whenever I work with clients and write a treatment plan for them and tell them what to expect, I always start with at least 6 months because it takes some time to build rapport with the client and get some data on them to see what they're like at different points throughout the year, because you see there's points in the year where clients do really well, and then there's just points in the year where they regress. And typically 6 months to 1 year is a treatment start. But then you have clients that might be in therapy for years, but it's not just a one and done approach where they come in and they get the diagnosis and they get to leave. If they really want the help and want to see the improvements, then stick with that 6 months to 1 year. And there's always the medication route, which sometimes is necessary. And it depends on the parents' beliefs that would complement therapy very well, where they're taking the medication. It's allowing them to retain the behavioral interventions.
Okay, and then if a person is predisposed to this compulsive obsessive behavior, let's say you worked out a plan to stop obsessive hand washing, but then a few months later, a new obsession began. So, how can you coach and guide parents as well as their kids? What can they do? Is it pretty much they have to accept the fact that we fixed one problem, new will arise, and that's for the rest of their life? Or you think there's a way to develop skills that can build more resilience and maybe avoid some of those obsessions down the road?
Yes, I think there's a way to develop skills to help with any new obsessions and compulsions that would develop down the road. And what it comes down to is, what is that belief that is driving the compulsions? Because with the cognitive behavioral approach, if you can address the belief that is driving the compulsions and you work with that, then you can see these compulsions decrease.
Mm-hmm. Okay. Can some people stay germophobes or have some kind of a, for most people, irrational fear for the rest of their life, and the amount of therapy and explanation is never enough? They'll still believe that if a germ exists, it's gonna land on me and I have to wash my hands no matter what. Are you aware of any extreme cases, or you think pretty much any case can be solved with the right approach to the therapy?
I have seen some cases where that fear exists for years, but they have points in their life where they're doing really well and the fear is not coming up. And then at some point, the fear could flare up again. And then if they've already been in therapy for years and they know what's worked for them in the past with decreasing the fear and decreasing the compulsions, then they can go back to what was working for them. So if it was therapy, if it was a certain type of medication, go back to that. And then if that's not working, then you reassess and see, well, what else do I need? So yes, I think it can always be there, but I do think that there can be times where it's not causing any distress to the client's life and they're managing it.
Okay, and then some kind of a life event, maybe a big stressful event, may trigger it again.
A life event could trigger it. This case that I have in mind was the change of a job. So this was with an adult. So I think any life transition can trigger that. And again, it just depends on who the client is.
Mm-hmm. Okay. So, any final words of advice, wisdom to parents who have kids that struggle with OCD and addictions, screen addictions, compulsive behaviors?
Be kind to yourself, because I know that you have a plan on paper with all of these interventions and it sounds really great and that it's going to run smooth and as expected. But when you go to carry out the plan, life happens and there's barriers in the way. So don't get discouraged whenever it's not going according to the plan.
That's a good reminder.
Yes,
Thank,
keep going.
Thank you, Alex. And where can people find more about you?
So, I have a profile on Psychology Today that tells you more about who I am as a counselor and the diagnoses that I treat and insurances that I accept, and they can reach me through that way. If they want to call me, my phone number is 724-546-5302, and they can reach me via email. It's alexandra.dimoff.lpc@gmail.com. And I'm also on Instagram under the same name where they can find different tips. And I have some client testimonials on there and I showcase my office space.
All right, wonderful. Well, thank you so much.
Yes, thank you again for having me.